I know the rain took a lot of energy this weekend. I hope everybody was safe and got through it fine. I was up in Cranberry trying to get to see my mother, and all 5 roads were closed, so I got to live it full force. They got 9 inches in an hour, and I think I was driving through most of it. But fortunately, everybody's safe, and we're certainly thankful to the first responders who got us all through that terrible rainstorm. So COVID. Let me start with some news for all of you. Just a reminder, here are the conditions that are eligible today to receive the booster shot. And I'm listing those so you can see all of the people that are now eligible. It's basically immunocompromised, and there's specific conditions that people have indicated. In addition, however, the CDC has already authorized that for anybody who has received their second shot 8 months from that second shot. We have vaccines available on both our Mullica Hill and Vineland campuses. You can see the hours on the screen also. I would ask you to keep checking though. It is encouraged, if you had the Pfizer shot, that you get the Pfizer shot as your booster or as your third dose, or same thing with the Moderna. The J&J shot is not eligible for a third dose because it obviously was only a single dose capsule. Now, people have said to me, well, Aim, why is the third dose important, if I could get COVID anyway? The whole key of any of these vaccines is to minimize our symptoms and the impact of the virus on us. We have seen a tremendous increase in the number of COVID patients in our hospitals. It has tripled in the last 3 weeks from where we were to where we are today. And the whole point of the vaccine is to ensure that you don't end up in the hospital. We have very limited resources, as you've seen around the country. We are all working hard in healthcare to make sure that we can hire up and ready ourselves for what we know will be a surge, probably the end of September, early October. We're hoping, though, if we can encourage people to get their vaccines, that surge will not overrun our hospitals and not find what we have happening in other parts of the country with limitations on being able to care for people. That is our foremost concern, keeping you well. We all have a responsibility to stop the spread. 96% of the cases in our area are the Delta variant. This is a very, very pervasive virus. It doesn't care. It doesn't care how strongly you believe or don't believe in the vaccine. It's going to affect all of us if we're not careful. For those of us who attend church or synagogue on a regular basis, there are times that we hear things that we feel like are directly spoken to us. I certainly haven't held that happen in that sermon more than once. But Dr. Evelyn Ballaghan, who's our employee health expert and physician leader, was in church recently, and her priest started talking about an experience he had at an urgent care recently, and about the need to use those services and not delay care. And he had been struggling with a condition for some time. He went into the urgent care. He talked about how he was easily moved through and how the doctors treated him. And by the way he described the doctor and by the location that she knew he had used, she knew it was one of her own colleagues at our Tomlin station, Dr. Hendricks, who had navigated this journey with him. We've seen so many people delaying care because of their concerns of COVID and because of their concerns of just getting in. And we know that means that people end up sicker if they don't address what's wrong. Putting it off doesn't mean that it goes away. It just means that it continues to get worse in some conditions. And so we really encourage you to do as Dr. Ballaghan's priest did, listen to your body, go get the help you need, and allow us to partner with you to make sure that you have what you need to continue to be as healthy as possible during these very uncertain times. I know a lot of information is coming out and things are literally changing from day to day. So great news for all of you who have been waiting for that moment in time when the FDA removes the emergency use authorization and actually says that this vaccine is absolutely faced all the rigors of the FDA and is ready to go. And great news it is. So I'm going to go back and ask for those vaccine times we put up, our Mullica Hill and our Vineland times. Here they are. And I encourage you to really take advantage, whether it be at our health system or another. Get the shot. It's just too important not to. Until we meet again, be well and stay safe.